Hey everybody, it's Dr. Furs, facial plastic surgeon, nasal and sinus surgeon. We get a number of questions about facial fillers versus PRF or platelet-rich fibrin, which can also be used as a filler, and what the difference is between the two and why choosing one over the other. Well, first of all, fillers are substances that a number of patients will have injected in the face or other parts of the body too, where they need revolumization. A lot of people have probably heard of Juvederm or Restylane or some of those names, and those are a couple of the fillers that are very popular. Those fillers that I specifically mentioned are composed of hyaluronic acid, but there are a number of other artificial fillers that are made of other substances that can be used in the face. Depending on the substance will depend on kind of some of the risk and also how long the filler will actually last in the face. And depending on the filler that you use, certain fillers are recommended in various areas of the face. A very common area to have filler placed is underneath the eyes, but people will use them in the cheeks, the lips, obviously, and even in the nose. So depending on what a patient needs, we can find a filler specifically for them, for the specific location where they need the filler. Now, one of the newer substances that we're using instead of the artificial fillers is platelet-rich fibrin, or Easy Gel. This is a substance that we can derive from the patient's own blood, where we'll draw some blood and we'll generate a gelatinous filler from the patient's own blood and re-inject it. The advantage to using platelet-rich fibrin or Easy Gel is that it is the patient's own substance. There's no artificial substance there. There's nothing that they can react to or have an allergic reaction to. And effectively, it's all natural. And for that reason, many patients are favoring this over artificial filler. There are a number of risks that are associated with artificial filler, and a number of those risks go away when you use the patient's own platelet-rich fibrin for filling the facial deficits or other deficits in the body. Thank you for tuning in. If you have any other questions in regards to fillers, please leave them in the comment section. If you'd like a consultation in regards to fillers or platelet-rich fibrin, we're happy to see you. Give us a call. Check out our website and please subscribe to our channel.